the second part will include the ancillary benefits. So this first part, we're jumping into medical, and people will jump in as the presentation starts, though we will ask everyone stays muted while we go through the initial slides, and then we will open it up to questions at the end.
Great. And with that, Bridget, I'm going to just turn it over to you for us to go ahead and just jump right in.
Great. Thank you. And thank you, everybody, for taking the time to jump on this webinar. We're excited to share this opportunity with you, answer any questions that you might have. Obviously, it's a unique offering, so happy to take any questions at the end. But so as everybody's been made aware, this is an exclusive healthcare member benefit program made available to members of IFA Business Resource Group. And we're able to do this through various partnerships and vendors like CBIZ, being able to partner with unions, a sponsoring union, as well as what we will be calling our local union, Amalgamated Local 426. So you will see a couple different names. Again, it did take quite a few folks to help get this program launched, but it is a very comprehensive program, to say the least. So with that being said, what we talk about is that these are flexible plan designs. Really, we have nine options. They're comprehensive programs, allows us to provide affiliated members that are part of an affiliated association or organization access to these healthcare member benefits. The way that we do that is through an associate membership. So as a member of your affiliated association, you have the opportunity by becoming an associate member of our local union. And when folks hear the word union, no worries. This is really the vehicle that allows us to get these benefits to you. There's no voting, no collective bargaining. Again, it's the vehicle that allows us to get the benefits down to small employers, independent contractors, or sole proprietors. The benefits that are made available to you through Local 426 are healthcare, medical prescription, life insurance, accident, specified disease, hospital indemnity, and as of 2025, we're adding an auto accident medical reimbursement and AD&D, and I'll explain why we're adding those programs. So a little bit about the program. This is the sponsoring union that we're accessing is a self-insured Taft-Hartley Health and Welfare Fund. It currently has over 10,000 participating members. Because they're self-insured, they're taking all the risk on behalf of all the enrolled participants, meaning their membership proper, as well as our Local 426 members. You are paying what in the union world we call contributions, or what you might be familiar with, premiums, on a monthly basis. The rates run from a calendar year, and then rate increases will be applied as of 1/1. So the rate periods run January 1st through December 31st. So for example, if you are enrolling December 1st of this year, you will have what we call an open enrollment period January 1st, where you can either continue as is or make plan changes or terminate if that's what you would want to do. Every member, regardless of claims, group size, no matter where you are in the country, everyone receives the same increase and the same plans. Again, we're benefiting from the law of large numbers. We're benefiting from technically a large employer-sponsored plan. So everyone receives the same benefits as well as the same increases. as a self-insured program, Local 298, they do contract with all their vendors, including the network, the pharmacy, and third-party administrators. They do oversee their claims processing. They send out the ID cards and EOBs directly. Reason we call that out is you might have familiarity with the names CapCare, IFA, but we want to make sure that you're familiar with knowing Local 298 and 22, because that is where the documents do come from. So a couple of the differences with this program versus kind of what we call other programs, whether it's the exchange, commercial programs, what have you. This program does utilize a national PPO network. They partner with the union has a contract with the National Blue Cross Blue Shield PPO network, where if you look at plans in the market, the national network isn't always available, or you have to pay additional cost for that national access. The in-network coverage is in all 50 states plus DC and Puerto Rico. And with current programs or other programs, your in-network coverage normally is within your state or even a limited or a local network. Big thing here is coverage cannot be denied. So if you are an active member of your association, if you are actively at work, the program cannot deny coverage. Versus going to the other markets, they typically do medical underwriting, they use pre-existing, and in some cases, they can deny coverage based on that pre-existing or medically underwriting. Another big difference, this program utilizes 4-tier rates. It's a composite 4-tier rate. There is no age rating. There is no census data utilizing your age or the number of dependents. So regardless if you are in, California versus Florida, the rates are going to be exactly the same. Again, the 4-tier rates will remain the same throughout the entire year. This is a program that is also available to sole proprietors, including 1099 workers. Whereas today, if you're a 1099 or a sole proprietor, you don't have many choices. Your choices are to go to the ACA plans, the exchange products, or, if you are a sole proprietor and you have maybe 1 or 2 employees, or if you're a 1099, your employee may offer you this coverage. So a couple of the benefit plan highlights. These plans, out of the 9 plan designs, we do have 7 of the 9 are ACA compliant health plans, meaning they cover the 10 essential benefits. We do provide, if you are interested in additional information, you will get and can obtain a proposal that has more detailed information as it relates to the benefits. Plan designs will give you a little bit more information about what's covered, what's not. 100% of preventative care benefits are also available. We do have one plan that's considered a grandfather plan that actually has preventative services covered at a copay. These programs do have doctors, specialist urgent care copays. In-network coinsurance options range from 20, 40, 50%, even 100% coverage. In-network deductibles range from 0 deductible to 6,000. In-network maximum out of pockets ranges from $5,350 to $14,700. And then we do have copay only plan options with no deductibles, no coinsurance. Literally, these are plans that you used to see in the 80s before healthcare became what I'm going to call a commodity, right? So very, very good, rich plan design. It is obviously, because you have coverage for the most part first dollar with some deductibles. It is it is the highest plan as far as cost, but from a family perspective, it is significantly less than even the platinum plans on the exchange. So a couple of the things that are important to know, the plan designs are static. They can't be changed. They can't be revised. All supporting employers, as I mentioned, and members, regardless of the effective date, will have the opportunity to renew plans, review plans as of January 1st. A couple what I'm going to call differences between a union plan and a commercial plan. And again, it's self-insured. They determine their benefits and what they cover and what they don't. One of the things that we want to call out is the specialty drug coverage, that certain specialty medications are excluded. It does require pre-authorization for these medications, but what happens is, and we have more information on this, there are certain medications, and we're talking your tier 4, tier 5 high level medications that will be excluded. However, they do have a program with Payer Matrix that will work with members on manufacturer rebates, cost reductions, or coupons, and that the Payer Matrix works directly with the member. So while you are looking at this program, we can provide, and Todd and his team and our team can assist you with identifying what medications you may or may not need, how they're covered, what tier, and what the process would look like. So before you make any decisions, we want to make sure you are informed and educated on what that coverage is going to look like. The other thing that the program has is what's called related to automobile accidents. They exclude the program, medical program excludes medical expenses related to an automobile accident. Reason being that only 0.8% of all medical claims are related to an automobile accident. Reason being, auto claims go into subrogation, your auto policy typically pays, and then the default is the medical plan. So the union has excluded it. However, as of January 1st of this year, we will be incorporating and embedding an auto medical reimbursement rider. This will provide an unlimited auto benefit for medical expenses after your auto policy. So we have filled that gap. And we will also be adding a $150,000 AD&D policy to that. So it's already incorporated into the rates. Whatever medical tier of coverage you select, you will obtain that that tier of coverage for that auto medical reimbursement. So just to give you a little bit of a highlight of the 9 programs, and again, more detailed information, you can request a proposal from Todd. He can get that over to you. It will show the rates, more detailed information, more detailed benefits information as well. But just to give you a high level, we have the 9 plan options. Our base plan is our lowest cost program. It's a $3,000 individual deductible, no out-of-network benefits, 50% coinsurance, but your maximum out of pocket for an individual is fairly low compared to the commercial market. It's $5,350. So when you look at that, and everybody can look at healthcare a little bit differently. Do you pay as you go, or do you want sleep insurance, right? Do you pay the higher premiums, contributions, and know that regardless of what happens, you're just going to pay a copay? This is kind of how we have lined up these programs. So all in, a program like this is going to cost you less on a monthly basis as far as your monthly premiums or contributions. You are going to pay a little bit more for your benefits, but again, your parachute is $5,350. So after you meet your deductible, you pay your 50%, but you're capped at the $5,350. So When you compare that to premium and out of pocket on other plans, sometimes you get ahead, make out a little bit better. But again, Todd and his team can certainly help you with that analysis. The plans range from in and out of network benefit programs, again, 4,000 in-network deductible, 5,000 out of network, 20/80 in-network coinsurance to a 50/50. All the prescription programs are embedded in the medical from the point that the benefits are already set. However, something that is also a little unique is that the medical deductible and max out of pocket doesn't apply to the RX. So the good thing is that in the commercial market, typically you see a high deductible and your medical and RX has to meet that deductible first. In these programs, you might have a high deductible for your medical, but your prescription is at a copay starting out. So very different. But again, very low copays as far as the RX programs. This program does have a mandatory mail order in about 20 of the 50 states. We do have that information all available to let you know what states you can pick up a 90-day at the retail, or you have to go through the 90-day mail order. The programs, again, in between, we have a Liberty plan. There's no deductible, no out of network, no co-insurance. Maximum out of pocket is $53.50, but all of your services are covered at a copay. So your PCP is a copay, specialist is a copay, your preventative's covered at 100%. I believe the hospital inpatient on this is a $500 deductible or copay per day, up to $1,000. So this is a fairly popular plan because again, other than high level services, you're really only paying copays. The high plan that I was saying is a lot like the plan you used to find in the 80s. This is a in and out of network benefit, no deductible in network, no co-insurance in network, no maximum out of pocket, and you pay copays for all of your services. This is, and again, when you get the proposals, this is a program where your inpatient hospital stay, regardless if it's 5 days, 100 days, is a $250 copay, right? So fairly low cost in relation to the benefits that you're receiving. This is the program that also is grandfathered and has a copay for your preventative services. Okay. So the program also, in addition to, I believe, what CBiz offers as far as other ancillaries, this does have ancillary products that you are able to select, that you are receiving these based on the large employer. So we have an accident 24/7, specified disease, hospital indemnity, even a life insurance. So these are voluntary. It can be paid by the employer, it can be paid by the employee. That's really dependent on how you want to set that up. There's no medical questions. It pays a lump sum. It is portable. No pre-existing. So the nice thing is it's cash in hand at a very low cost. If you want to help supplement, if you do receive or select one of the higher deductible plans. These are only available if you select a medical option. Okay. The other nice thing about this, you could take a family plan for the medical, but you can select what family members you want under these programs. So if you only want the specified disease for you and your spouse, you can select that. So what we've done too is to try and make this as simple as possible. We have an easy enrollment process. We have an online portal, enrollment portal, for the employer, for the employees or members to complete and access your information online. It simply starts, it is paperless, but it simply starts with you receiving a proposal. When you receive that proposal, you'll be able to look at the plans, the rates. You can look up providers, determine what plan's best for you. We then send you an account activation link. You simply verify your information, set up a unique username and password. Then you log in and you complete your member benefit program application. If you're an employer, you would complete your group profile, set up your class's contributions, enter your payment method, enter employees. And then once you enter your employees, you're sending them an account activation link. So then the employees can actually do their own enrollment online. Employees would then get a link. They would set up their profile, add dependents if applicable, make their plan selections. They would upload required documents. And when we talk about required documents, the union does require, if you are enrolling dependents, if you're enrolling a spouse, you need a marriage certificate. If you're enrolling dependent children, you need birth certificates. The system will prompt you to upload those. And then once the employee is complete, they will e-sign and submit. And then once all the employees are completed, the employer e-signs and submits, and then it's done. So end to end for any entity, if everybody kind of moved through that process, goes pretty quickly. The group in the member enrollment portal, again, it allows you as a group, as members, to complete the applications online, add, terminate members. You will see information in the system. You apologize for that. You will have access to your invoices, plan information, pretty much anything related to that member. The members, when they log in, will have access to their information, their documents. So we do house all of the documents within the system. So if you do need that, those documents, you can download them. The system does have an integrated billing platform, meaning that once you put in your payment information, we automatically bill on a certain day of the month. Currently, it's the 2nd of the month prior to the effective date, and we process payment on the 4th of the month. That is the current time frame today. We are looking to maybe push that back in 2025. But again, all of that information will be in the proposals, in the email confirmations that you receive. And once a member is enrolled, we do send out welcome emails. You do get a welcome letter that includes all of the plan information, who to contact and when, what to do, how to look up providers, how to set up an account on the Anthem website. Now, again, it's not an Anthem health plan, but because the network runs through Anthem, you will be able to create an account, look at your claims, look up providers. Anthem also offers other valuable resources like a telemed, other discount programs that's outside of this, but you get full advantage of that. And then again, the union themselves sends the EOBs and the ID cards. So that's not housed on the Anthem website. So, I've been enrolled in this program, just, kind of let you know, I've kicked the tires. I've been in the program for 4 years. I've been on every kind of health plan between the Blue Crosses, the Aetnas, the Cignas of the world. And this program is no different, doesn't act any different. Been very happy with the experience. Part of that too, when you enroll, we have a concierge team that when you are enrolled, our concierge team will be that liaison for you between you and the union, right? Or you and a vendor. So to take a little bit of that frustration, or if you have claims issues, benefit questions, ID cards, our team is there to assist you with that, to help. So with that being said, if you have additional requests, need information, want to take advantage of receiving a proposal, Todd is your go-to person. His contact information is here. I believe Brianna is recording this and will post this on the website for all of you to see. And obviously the contact information will be in the proposals as well. So happy to answer any questions that you folks might have.
Yeah, Bridget, I'll jump in on the first one that's just in the chat, if that's okay. And someone
Sure.
had asked about how they get more details to the employees and what the timeline is, if you can speak to that.
Yep. So what happens is if we kind of walk through the process, you would request a proposal from Todd. If you elected to move forward with that program for you and your employees, then Todd can work with you. Todd and his team can work with you on how to cascade out the information to the to your employees, right? I mean, sometimes depending on how many employees you might have different contributions, you might want to do an education session with them. So Todd and his team, our team can always jump in, but it really wouldn't be different than what you do in the commercial market today, right? So you decide on a program and then you share that information with your employees. Then once you move forward, you would set up an account online, add the employees, and then send them account activation links so they can do their own enrollment based on the sessions, education sessions that you had with them. Does that make
And
sense?
this, I'll just add that summaries of benefits and coverage are available through the website as well. And all 9 medical plans are available. You as an employer are not having to select which plans you want to offer. All 9 plans are available to all employees, so that there's no, it's not like what you're used to where you got to pick 1 or 2 plans and squeeze everybody into those particular plans. With this program, all 9 plans are available, and it is fine if you've got 7 people and they choose 7 different plans. That is absolutely fine.
Yep.
Thank
Yep.
you. And we've got a couple of other questions. I think it'll be easier if I ask these throughout the chat, just in order here. And the next was just if you can clarify, is this program a MIWA that falls outside of state insurance regulation?
Nope. So a MIWA, so the acronym, right, is a multiple employer association, welfare association. That is normally when an association puts a program together for their members. This is a multi, right? This is a union, Taft-Hartley Health and Welfare Fund. So yes, it might use the same acronym. It is a ERISA DOL regulated program. So it is not a state regulated program. So MIWAs, for lack of better terms, association health plans, are state regulated in a lot of instances. They're state and federally. This is a program that is just a federally regulated program.
Thank you. And he had asked if that's why the term self-insured was used.
Not necessarily. I mean, for self-insured can be any employer. Taft-Hartley is really the key. Health and Welfare Fund is really the key kind of recognition to the program. But again, it is an ERISA Department of Labor oversight. And the way, just to kind of clarify why we're able to do this, in technicality, this is not what we consider an employer-sponsored health plan, right? So a MIWA in its natural state is an employer-sponsored health plan. The members themselves, your employees, are actually the ones that are becoming associate members of the local union. Associate memberships have been in place in unions since the early 80s. It really was a way for unions to offer the benefit, full scale of benefits to apprentices before they were full-fledged union members. So we're just piggybacking off of that same definition and rule that's in place.
Okay, thank you. And another question from someone was if they have a partner, but they are not married, meaning no marriage certificate, can they cover them?
Unfortunately, the union does require marriage certificate and a married spouse.
Okay. And then another is with some of the ancillary benefits or riders, are there any prescription drug plans that can cover any specialty prescriptions not covered under the medical plans?
We don't have anything specifically at this point. We are researching options, and maybe that's something Todd and his team can look into as well.
Okay. And who are the principal members of Local 426? It's just
Well, so Local 426. It is the Southwest Union's fund. There's no principal. I mean, the members are all of you that enroll, right? I'm a principal member of Local of 426. The association, Employers Association, the hierarchy is New York Practice Management that sponsors Local 426. The sponsoring union is Local 298 and 22. They are a toy and novelty union out of New York City. And again, those primary members are various entities that are board members of that entity. Now remember, self-insured health plans and plans like this are not for profit. So there are no shareholders, there are no stakeholders. Yes, they have employees and they have different vendors, but it's a member-based type program.
right. Thank you. And then another question is, it's a couple of people have been asking about dental and vision, and I'm trying to respond to those in line. We will get to that on the next part of the webinar. There are dental and vision options through ancillary coverage that we will cover, just not through this portion. And then someone had asked if this coverage was considered credible as per Medicare, just because they understood it as you had to be more than 20 employees.
So again, you're enrolling in a large group health plan. So technically this is credible coverage, right? Because you're coming in under a group that has over 10,000 members.
Yes. So meaning she's saying those who are 65 or older can enroll.
Correct.
Yep. And then someone had asked if there are dues associated with being a member of the union. As a member of IFA, those are those membership dues. And then I believe anything tied to the union is baked into the rates for the plan.
And so yes, the dues, it's $36 a month. Part of the application process is there's an enrollment form. There's what's called a dues authorization form. There are disclaimers when I talk about e-signing and submitting that you e-sign understanding that. So, but it is baked into the rates.
Okay. Another question is, are monthly costs defined as premiums or association costs? I ask because I'd like to know if they are deductible to S Corps as self-employed health insurance.
So they're considered premiums in our world, right? Based on the union's language, we call them contributions. I'm a self-employed employer. I deduct them for my tax purposes.
Yep. Thank you. And then vision and dental, again, we'll get to that. Someone asked if we have 9 employees, but only 5 are participating in this plan. I'll get to that one in a minute, Sean. I'll answer that in line. Same with the union dues, which we've covered. Someone had asked, are you a certified professional employer organization, which is separate, tied to membership? No, this is not anything like a PEO. You do not need to no one has to be employed by any other group. You will remain the employer. Everything will remain the same. There's no payroll, HR aspects that will be tied into this. Let's see here.
Do you want to go back to Sean's question, Brianna?
Yes. He just asked if we have 9 employees, but only 5 are participating in this plan. Do we fall under the 2 to 5 employee membership? I think he's just referring to the membership to
To
IFA.
you. Okay.
Yeah.
For IFA,
Yeah.
yeah.
Yeah, for IFA, it's based on the team size regardless of enrollment. That stays the same. This is just an added member benefit plan to being a member in IFA.
Yeah, and just kind of from the program perspective, this is a program, again, not an employer sponsored program. So the benefit to employers, right, where there are no penalties if you don't meet participation, contributions, what have you, right? So this truly is, and people chuckle when I say this is no different than you offering your employees a Costco membership or a Sam's Club membership, right? You're just offering them a healthcare membership to enroll. So if you have under this program, Sean, just, and again, I know it's not related to the IFA question, but if you had 9 employees and out of those 5, only 2 enroll, that's fine for us, right? Because it's not an employer sponsored plan. So you don't get penalized like you would in the small group market for not having participation.
Yeah, and then another question is, can you jump in and out of the program throughout the year?
Not in the way that I think it's being asked.
Yeah, so if someone was enrolled January 1 and you decided the plan wasn't working in May, for example, purposes, I think they're asking, could they come back in, August? And is the answer no?
So if so kind of the standard rules apply there, no different than the commercial market. So let's say you enroll January 1st, your spouse gets coverage with another company March 1st. If you terminate, and then let's say your spouse leaves, gets fired, and you need to come back in, under those circumstances, based on qualifying events, then yes, you can, as long as you can validate the loss of coverage, you can come back in. If you wanted to come and then leave and just go somewhere with no qualifying event and come back in, you would not be able to come back in until the next open enrollment, which would be January 1st.
Yeah, so similar to any plan that you've ever participated in with a large group employer, you have to have a qualifying event to typically terminate and re-enroll.
Yep.
Outside of open enrollment. And then another question about HSA plans, which, as we know, none of the 9 right now are HSA eligible. And the question is, at some point, will there be any plans that are HSA eligible?
We are working with the union on that. So we are hoping, and we have shared a few HSA plan options with them to review and hopefully add to their portfolio.
Okay. And a couple of other questions. Does this program fulfill the requirement for state mandates? For example, being in California, a penalty is stiff if not met.
So there is, again, the state mandates don't apply. So the penalty, so if I'm understanding the question, Brendan, is that from an individual perspective or from a group perspective offering coverage? So
from an individual perspective, yeah, I mean, California has this, I know there's no federal mandate, but California has its own state mandate. And so, I have to, for I think 9 out of 12 months or 12 out of 12, whatever, get some box check that says, look, you've had health insurance. And if you don't, then there's some super stiff penalties. It's income based. So that's kind of the question.
I mean, if you enroll in the program, obviously it would fulfill the state mandate, right? So at the end of the year, the union actually sends out those 1095 or 1094B forms, validating that you've had coverage for those months.
Perfect. Yep, that's what I'm asking.
Yeah, good question. Another question is, as employers, how would an employer adjust plan cost coverage between owner, entity, and employee, set a rate, and deduct fee? We'll cover that separately. If an employer wants to cover 50% of the premium cost for employees, you would still pay 100% of the premium through the billing, and you would deduct their portion through payroll.
Yeah, and Brianna, just to add to that, in the system itself, right? If you're setting, you can set up a contribution strategy so it does funnel through when the employee is enrolling, they will see what their net portion is. So you can set that up for your purposes, right? More for organization, and set up different classes and contributions within the system. But you would
And then,
you would
and then
manage that
you can
with-
export it, Taylor, for example, to say, hey, let's say for easy math purposes, the premium's $500, which or 1,000, and you cover 50%. It would export it, and you'd say, okay, based on what I'm seeing, I need to deduct, 500 from their paycheck, and I'm paying the other 500, so that you can have that reporting. And just as a follow-up, I appreciate this, Sean, to make sure we're clear. So he says, if I have to enroll in Medicare over the next 3 months, could I use this as primary insurance until I retire?
The union is, I think the union is a primary. I'd have to, I don't want to give a wrong answer here. I believe this program is primary. Yes. If you do not elect Medicare,
This
that's not a
would
problem.
qualify as primary coverage.
Yes.
Yeah.
Correct.
But if
And
you
one of the
do-
stipulations is you do have to be actively at work in order to be covered under this plan, so that if somebody does retire, then that would be their qualifying event to enroll into Medicare as well for their Medicare Part A, B, and D, as well as any supplemental plans. That would be your qualifying event for Medicare enrollment.
Yep, correct.
Yes, thank you. And then a question, are the annual deductibles prorated if you enroll mid-year? I would say no. No. The deductibles apply regardless of when you enroll, which is a good follow-up to the next question, asking if you can enroll essentially in any month throughout the year. Yes, the requirement is you must enroll at least 30, you must have paperwork in at least 30 days prior to the effective date. So for example, for January 1, all paperwork will be due by November 30. And then for February 1, it would be due by 12/31.
Right. So Mike, the nice thing here is, you're not going to have to wait for rates. You can actually get a proposal, and then come September, the plans and rates are going to be exactly the same.
Because they're for the entire year.
Yeah.
Someone asked if someone is currently on Cobra, could some members stay in Cobra while others join this? Yes, I mean, your business is the member of the association, and then in turn has access to this member benefit plan. So if only one person on your team was interested in enrolling through the member benefit plan, that would be okay. The thing to keep in mind is your membership with IFA remains the same based on the number of people. So for example, Alan, if you wanted to enroll in this, but everyone else on the team was interested and who had access to Cobra elsewhere, you could do that, and then they could access this plan once they were interested in it and Cobra expires. That would be a qualifying event.
Yep.
Correct. Go ahead, Bridget. I think you're going to say the same thing I am.
So I was just going to say, so again, I keep going back to non-employer sponsored program. If you have a member while you're enrolled in this that does terminate, in technicality, you are done with that member, right? The union then handles Cobra from that point on. So there is, the union collects they send out the notifications, they collect the Cobra premiums, they do everything. We really don't see them. So let's say.
And Bridget, really quick, I think you're answering as though Alan was saying if he had an employee who left. I think what Alan's asking is he or someone on his team right now might be on Cobra from a former employer. And so he's just making sure it's okay that someone did that while he was in the plan. But I'll let you continue. I appreciate what you're going into now.
Yeah, no, and I just, because again, we're on that topic, and I completely understand that question. I think point is that when we have Cobra members as an employer, if you switch plans, you have to bring them over. So that employee can stay where they are, but on our program, technically, If you were in our program and then you decide to go somewhere in a year, remember that member can stay in the COBRA on the union. And from your perspective, you don't have to bring them with you is, good and bad, but I've never had great experience with COBRA members in the ex-employees. So
And the only other thing I would add to that, if you are on COBRA from a former employer, that if you decide to come onto the program through IFA now and other employees stay on COBRA, that is fine. But the employee then only has the opportunity to come back onto the IFA plan at the January 1 open enrollment or at the end of their 18 months of COBRA. Just deciding you want to stop COBRA after 13 months is not considered a qualifying event that would allow them to come onto the plan through IFA. It's either the open enrollment on January 1 or the exhaustion of COBRA through the full 18 months, 27 or 36, depending on their COBRA situation.
Yes, thank you. I think that was also the basis of the question. And then we have another person who's asking, right now we only have 3 employees, my husband, our associate, and myself. Our associate has coverage elsewhere. Can we just do a plan for ourselves and our family? Yes.
absolutely. Yep.
Yep. As employers, how would an employer adjust plan cost coverage between owner entity and employees? Set a rate and deduct. Yep, we'll get into that a little bit. I think that was the one we had.
Yeah, it was
Taylor,
the same
maybe, can
question.
you unmute Taylor to clarify if there's something we're not answering?
Yeah, sorry, I just had a slight interruption when you were answering my
That's
question.
okay. No worries.
Yeah, so we basically we can put out a rate that's internal to our office with the staff, and then if they choose any one of the 9 plans, we just apply that percentage to the plan cost.
Yes.
Is what I took away. Yeah, okay, great. Thanks.
Right,
Yeah.
you can do a percentage or a flat dollar amount. That's entirely up to each individual business
Right.
as far as what you do.
Yeah. The mechanics here lend themselves much more easily to a flat dollar amount than like on the marketplace where a percentage and you pick one. Yeah. It depends on perspective. Thanks.
Yeah. Another question, are there retiree benefits? No. Okay. If the employee chooses employee plus spouse, can this be a spouse's primary plan if they are over 65 eligible for Medicare? Good question.
Yes.
Yes.
This would be their primary plan. Yep.
Yep. Oh, good question, Greg. If a member takes a month sabbatical, does it fall into an inactive employee for medical insurance purposes since they are not actively working?
So, in most cases, right? So I think it really depends on the circumstances, and I can't speak to the union and what they do, but if you're taking a sabbatical because you're forced to take a sabbatical, right? I know there's some companies that force you to take a sabbatical. The union looks at it on an average hours per month and total hours in a year. So what I will tell you, depending, if you take a sabbatical because you're getting treatment for something, the union may ask for verification of actively at work and what the circumstances are, right? And I think any insurance company would probably do that, for whatever reason. So technically, yes, that you would be considered actively at work. Again, I think the union's criteria for actively at work is on average 70 hours in a month.
And that's over the course of the year from a calculation standpoint, or 70 hours in a given month?
I think they look at it on a course of a year.
Okay, so 840, right, would be technically the definition to
Right.
meet, or 864-ish would meet the definition. Okay. And then a good question. Thank you, Adam, for being patient. Will we get a general overview via email? Do we get that from Todd? There will be a general overview, though specific quotes can be provided as well, which we can include dental and vision if you have to go. So just know that'll be coming as well. And it looks like Todd responded to him as well. And then what if it's not a sabbatical, but it's maternity leave?
Yeah, that should be, I mean, that should be covered. Again, we can dive into the summary plan document, but for the most part, you are actively at work, other than, requirement to take off. So we can dig into that, Todd. I think maybe for Ron, let's look at the SPD just to confirm their language around maternity.
Yep.
Okay. And then the 2025 rates are available. Bridget, do you have those here? What's the best way to share those? Obviously, everyone had seen 2024, and it was about an 11% increase just from a numbers perspective to gather. And then in terms of who does qualify, asking if there's a part-time employee, do they qualify if the business wants to qualify them, or is there a minimum number of hours they need to work, such as the 864 per year?
Now, really, the unions just states actively at work. So part-time employees, 1099s are eligible.
Okay.
And I did send Todd and Brianna the 2025 rate proposal over to you.
Yes.
Prior to this call.
Okay, great. So we got it updated because, yeah, we followed up with an email on that as well. And we will get the 25. We will, when we send out the recording, because everybody will have access to a link of the recording, will include a listing of the 2025 rates.
Yes. Yes. Thank you. And then Penny, one other thing I would just add about the part-time question would be, it could then be up to you to determine if you then subsidize less of the part-time employees' rate or premium, however you want to say it, based on the number of hours they work. So an employee could have 100% of whatever you're willing to pay, and perhaps part-time is prorated based on their working arrangement. And Taylor, we will send that out.
Yeah, and I mean, and the reality is that if you have employees who are going to be part-time that are going to be participating in the benefits, and you want to offer a different contribution level for part-time versus full-time, you just want to make sure that you are not discriminating within a class of employees. So that if you're doing a contribution for full-time, it can be for, and Bridget, correct me if I'm incorrect on that, but that, if you're going to cover 80% for full-time employees and 50% for part-time employees, that is allowed from a contribution perspective. You just don't want to do anything within a class that is discriminatory.
Right. I mean, not to complicate it, you're correct. And I think for best practices, that's the way you want to do it. From our perspective, we don't manage or monitor that. That's truly up to the employer.
Right. It's different than what you're used to with traditional insurance programs, where the carrier does have a minimum 50% contribution requirement.
Good call out, Todd. Yes. More control, I guess I would say here.
Correct.
What that looks like. Yes. So in terms of the 2025 rates, those will be sent. We don't have them here, Bridget. We had sent a follow-up. I think that was 2024 that was attached there. So we just need to make sure we get the updates so we can send that out. And then I think I'm just looking back through to make sure I didn't miss any questions. So requesting the proposal, obviously the rates will be a big part of reviewing that with the 9 plan options.
And Bridget, you're still sharing your screen, so you may want to.
Yeah.
Sorry. Thank you.
So the requesting a proposal, if there's the medical and dental included as well, there will be 2 steps essentially, which, well, Bridget, I don't know if you're looking for that quick to look at what needs to be sent out. That'd be great. And then in the meantime, I know we're at an hour here, though we still have time to continue through some other things for those who can join. If you cannot, we will send the recording out to include this, but I would like to go over the dental and vision aspects as well, and then some other ancillaries that Todd has to share.
Great. So let me switch to my sharing here. And we'll make sure that it's the correct screen. All right, and just confirm, Brianna, that we're able to see that screen there.
Yes, we can see it.
Great, great. So first of all, Bridget, I want to say thank you for your expertise on the medical program, and that certainly both Bridget and I, as well as Brianna and team, are all available to answer questions. In addition to the medical benefit program, we are offering ancillary benefits to the different financial advisor offices. These are separate and outside of the union program. For the medical coverage, we've entered into a partnership agreement with Principal Life to be able to offer ancillary benefits for all sizes of businesses, as long as there are at least 2 employees, and that can be 2 owners. It can be 1 owner and 1 W-2 employee. 1099 individuals, if they have ownership, can be included in these benefits. If it is simply a roommate situation, 1099 roommates cannot be covered under these ancillary benefits. They can be covered on the voluntary benefits, but not on the ancillary. But we will also have resources available for individual or sole proprietors that want to have dental, vision, life, or disability coverages available to them. But just starting with the initial core ancillary benefits, those being basic life insurance with accidental death and dismemberment, short-term and long-term disability. We do have a 3-tier program set up. The first one being for employers and entities that have 2 to 4 employees, those that have 5 to 9 employees, and those that have 10 or more employees. And the main differences between them is certain coverages are better as you have more employees, and certain coverages need what's known as EOI, or evidence of insurability. Basic life insurance, what most entities are used to, is a one-time salary up to $50,000 of life insurance. And that is available on all packages. For the 2 to 4 employees, evidence of insurability is required for all benefits there. But we do also have the ability to go all the way up to $200,000 on the life insurance for the 2 to 4 employer or employee groups, because we're not able to offer additional voluntary term life insurance, so that Principal has agreed to go to higher limits there. Short-term and long-term disability, these are benefit packages that provide a benefit in the event that somebody has an accident or illness that precludes them from being out of work for a specific period of time. That is what the 8/8/25 refers to. 8 days for an accident, 8 days for an illness, and then up to a 25-week benefit period for a short-term disability with a maximum weekly benefit of $1,500. Long-term disability kicks in at 180 days, which dovetails on the short-term disability, and that is a $6,000 monthly benefit, which is guaranteed issue even in the small groups.
And then Todd, a quick question on this as you
Yeah.
go through it, as I'm sure they're thinking, in these instances, does this require, in whichever one of these buckets you fall, so 2 to 4, 5 to 9, and I know you have another page coming at the 10 plus, does it require 100% participation for however many employees you have within that bucket, including the
Great question. Great question. So these are based on being employer-sponsored plans for these 3 core benefits, meaning that the business is paying 100% of the cost for these benefits. We do have the ability to exclude principals of the business. So if for some reason you feel that you don't need to have the basic life and disability coverage as the owners or principals, we can exclude you from the coverages and just provide the benefits for your staff, your account executives, etc. And then it would be based on which category you would fall into, would be based on the number of people who would be covered in the program. So that you might be an entity of 7 people, 3 being principals, and you want to exclude them, then we have 4 that are participating, and it would fall into the 2 to 4 category. But great question, Brianna.
Yeah.
So in the 5 to 9 employee category, We do have that first 50,000 of life insurance is guaranteed issue. That's the GI there. And we can do up to 200,000 there with additional evidences of insurability. The short-term disability benefit is the same, but the top 3 salary earners can actually qualify for a higher benefit, because generally your principals will have higher earning than the remainder of your staff. So we can put in a higher benefit there. And then the long-term disability benefit, the max benefit is going to be based on a top 3 salary test to determine what limit will be available from $6,000 up to $15,000 a month of benefit. Once we hit 5 employees, we also have the ability to offer voluntary term life insurance that has guaranteed issue limits there. On the smaller groups, the 5 to 9, it's 30,000 guaranteed issue for employees, and then they can get 20,000 guaranteed issue for spouses. If we just go to the next slide for 10 plus, you will see that we now have our guaranteed issue amount bumps up from 50,000 to 100,000, and the maximum available goes from 200,000 to 500,000 with the evidence of insurability. The short-term and long-term disability benefits are the same as on the previous slide for 5 to 9, but the voluntary life guaranteed issue benefit increases from that 30,000 for the employee up to 100,000 of guaranteed issue. For any of the programs, if you were to offer and provide disability coverage, whether short-term, long-term, or both, principal will include what's known as an employee assistance program, an EAP. This is a great resource that many of you have available with current employers for when life happens, is the best way to put it. It is a confidential service that is available 24 hours a day, 7 days a week, almost 365 days a year, to help folks when they're dealing with challenging situations in life, whether that's something related to finances, whether that's something related to mental health, family issues, etc. But that is a no-cost additional benefit that is available for everybody who would be offering any of the disability services. And again, a great resource to have there. Additionally, we are going to have available some voluntary benefits through our partners at Colonial Life. This is very similar to your Aflac or MetLife style benefits, that these are strictly voluntary and paid for by the employee, that we can offer an accident, critical illness, hospital indemnity, or additional life insurance, but what is known as whole life, that has a cash value component, but also offers a long-term care rider attached to that life insurance policy through Colonial. And then lastly, what we have on here is something that many of your current employers or former employers have had available, is a business travel accident policy for all employees. This is something that can be offered by each individual entity to all of your employees. It is a flat fee from 2 employees all the way up to 249 employees. It's an annual cost of $750, regardless of the number of people that are being covered on that policy. And it provides a 5 times salary benefit up to a maximum of $500,000 for business travel. And if for some reason spouse or children are traveling with the employee during that period of time that they're traveling for business, there are benefits available there as well.
And then Todd, can we go back to the dental and vision for a minute?
Of course.
I think there will be a couple of questions, and one Robin had added, which is a good question I knew we'd get to, is, are there any benefits like this available for single employee businesses or sole proprietors?
Great question. So while Principal does not have individual policies available, we do have resources through folks like Delta Dental, Beam Dental, VSP services, et cetera, community eye care, that will have, depending on where you're located, we will have individual resources available for dental and vision coverage, so that, you know, we can work with individuals or entities in those situations to get them those benefits. And similarly for, I didn't put a slide in here, but in the event that there's a need for other coverages related to business agreements, that we can provide assistance with shareholders agreements, buy sells, etc., that we can be a resource for that as well.
And then, Taylor, I think you're asking underlying for dental and vision. These are through the principal.
Right. So dental and vision is all through principal. For you, and those are national networks as well. They have national provider networks.
Yeah. And then bouncing back for a minute, this is a good question. I want to come back to it. And Bridget, I'm not sure if you got the tag or had seen it or if you can hear us now. There was a good follow-up question of, is there any risk that a self-insured program would not pay a claim on the medical side of things?
So, I mean, I don't think that risk of not paying a claim is distinct to any self-insured. I think really that as long as the benefits covered, the provider and the member go through the process of receiving the pre-authorizations, what have you, there really should not be a reason, as long as it's a covered benefit, to not have it be paid. Being a self-insured plan, they have capital financials in their accounts to pay the claims, if that's the relevance of the question. And then they have stop loss to cover any high level claims. So there really is no reason why it wouldn't pay, again, as long as it's a covered benefit and the members follow and the providers follow the pre-auths and what have you.
Okay. And then a lot of the questions were about getting the rates, which we will send those out with the recording and the recap. So you have everything here. And then, Bridget, I believe you'll be sending everything that you had presented, although it's in the recording, but if somebody just wanted to be able to read through those slides, that should be fine as well. The question is how to get the official quote to keep things moving. Obviously, you'll have the rates for the medical, though we will walk you through what it looks like to get that formal quote. And then Todd, what's the best way if they would like to say, hey, when I look at this, I also want to see the dental and vision and any other ancillary aspects? And then are there any restrictions to which of the ancillary products could be included, or is it all or nothing?
Great question. So as far as obtaining a proposal, while yes, you will have the medical rates in hand following the presentation, we can get you a formal proposal based on your employee demographics, and so that we can collect census information and put that proposal together for you. We will also have an area on the IFA website where you could self-generate one if you want to, but we can certainly do that for you as well. The principal coverages generally are pick and play, if you will, that it does not require that you take multiple lines of coverage. If you only wanted basic life insurance, you could do that. There are bundling discounts. If you do 3 or more lines of coverage, it does have an impact on the rate. So typically we do see people do the basic life, short-term and long-term disability bundled together because it will have a lower rate there. But as far as the voluntary, the business travel accident, those are all a la carte is the best way to put it.
Okay. So when we send this out, is it best to have someone respond and say, this is exactly what I'd like to see, and then we can put it together and send that in the coming days? Correct.
And then we can send out a census template form for everybody to share their information, and we can then begin generating the proposals for them.
And then, yeah, and just to be clear on the census aspect, that's only for the principal items, I believe, correct?
As far as for quoting purposes, yes,
Yep.
but we can use the census information to put together the formalized proposal on the medical as well.
Okay.
That'll be specific to everybody who's in your office.
Okay. Perfect. And thanks for sending that update, Bridget. So we'll have the entire webinar and the supporting documentation sent out a little bit later here today. In the meantime, I know we've covered a lot of information. Does anyone have any other questions? And if other questions come up after this, we completely understand, and that's to be expected. And please reach out. But otherwise, right now, we've had a lot of really great ones. Thank you all so much. Anything else right now?
We look forward to working with all of you, and we'll speak to you in the coming days and weeks.